Hey guys, welcome back to my channel. My name is Nancy and I do videos on nursing, lifestyle, travel and a lot of other things. If you're new here, feel very welcome, and if you're coming back to watch another video, thank you so much. It does mean a lot to me, so welcome. And in today's video I'm gonna talk about the responsibilities of a nurse in a nursing home, and this is because of a video that I did previously. By the way, thank you so much for supporting my video. It has gotten a lot of views, nice comments, and they encourage me to do more videos, and that's why I'm doing this video here. And once I posted that video, some people messaged me in my Facebook and others on Instagram wanting to know the responsibilities, because I think I kind of mentioned that the home I was working in on that day is different from other nursing homes in ways that the nurse doesn't have so many responsibilities as I feel I have when I go to work in other nursing homes. I just wanted to mention a few responsibilities because people were curious and they want to know what they'll be doing once they get to the UK. So let's get started with today's video. Okay, so as a nurse in a nursing home, you have several responsibilities, and one of the major responsibilities is medication. I'm gonna talk about medications because it's one of the things that you should take very serious, and medication sometimes puts people in problems. So first thing I would like to say about medication, please read the medication policy of your home or your company, and also follow the Nursing and Midwifery Council medication administration policies, or they have a guidance on medication administration. So if you follow that, that will be really helpful. So your responsibilities in terms of medication are: number one, you are expected to order the medication for the residents. Now in most of the nursing homes that I've seen, there are medication cycles, and each cycle is usually 28 days. So you as a nurse, it's your responsibility to order the medication maybe in the second or even in the first week of starting the medication, so you can send your papers in time to the pharmacist and to the doctor. And you also need to give time, or enough time, for the pharmacist to supply the medication, and then in between you'll be checking. So ordering medication is one important thing. So number two, in medication, it's your responsibility to check the medication once the pharmacy has delivered it. So before each cycle, you kind of have to go through each box of medication, even count the number of tablets that you've been sent, or the bottles of liquids, or whatever it is. And it's your responsibility to make sure that you've received what you ordered. If you haven't received everything, then you need to contact them to top up so you can have enough for the new cycle coming up. Number three, it's your responsibility to change over the medication for the new cycle. Now, you're not the only nurse in the home, so you're gonna be sharing these responsibilities, but I'm just talking about all of them so you guys are aware if it happens on your shift. So usually in a lot of them, I've seen that during night shifts, that's when the changeover is done. For example, if today is Sunday and the medication cycle is ending today, then the night shift nurse is going to take that responsibility for changing over the medication. So tomorrow in the morning, there is medication from early morning, breakfast, lunch, and so forth. So if you're doing that night shift, probably it's going to be your responsibility, and you're also doing that while checking if the numbers are correct, if you received the proper medication dose, if the prescription and the instructions are what they're supposed to be. Number four, as you all know, is administering the medication. So here, you guys, you have to be careful. Make sure you're administering following the 6 rights of medication administration. I think there are 7 or 8 now because people have rights to refuse and things like that. And I think this will depend from home to home. So in some nursing homes, like the company I used to work for, they're slowly transitioning to electronic MAR charts. In some homes, you're going to have like paper medication administration charts or MAR charts. Also, another difference is that in some homes you're going to have a medication trolley, which you're going to be wheeling from one room to another, and in others like this one, the medication is locked in each cupboard for each resident in their room. Another responsibility is discarding the medication. So you have to follow the policy of that home, because in other homes I've seen the policies are different in terms of how you discard medication. So be very careful, especially for the CD drugs. If it says 2 nurses, then make sure it's 2 nurses. If you're supposed to sign somewhere, wherever you're supposed to discard the medication, make sure you follow that according to the home's policy. If you don't know, always ask. Another thing that people always leave out is counting the medication. So for instance, today I come for the morning shift and I'm administering the breakfast medication. After each administration, or after popping each tablet, I'm supposed to count the remaining tablets and record that balance. Okay? In some homes, I've seen a difference where you record at the end of the day, and in others, you record after each time you give. All right, so I think, guys, that's it for medication. Be careful with medication. They say it's the resident's property. It's not like where I come from. If one patient lacked paracetamol and the next one had paracetamol, we would borrow, but that's not allowed here, or at least in most of the homes I've worked, it's not allowed, because that box of paracetamol is a property of that specific resident. It has their names, everything is signed and assigned to them. So if this one doesn't have, then you need to ask the doctor to prescribe. Okay, so be careful about things like that with medication. They seem very small, but they can actually lead to serious trouble. Another responsibility for the nurse is to register the resident with the local GP surgery. By this I mean, everyone in the UK, even you guys, when you arrive, you're going to register with your local doctor. That's called a GP surgery, and that means if you feel unwell, that's where you'll be going. These residents are coming maybe from their home and they have their own doctor's surgery away from that area, but once they arrive in that nursing home, you need to register them with the local GP surgery. In case they are not well, or in case you need to call the doctor, you'll have to go to the local one, but for you to do that, you must have registered them. So once your resident arrives during the admission process, before you even start the care plans and assessments, please remember to register your residents. Another responsibility is referring the residents to the other multidisciplinary teams, for example, TVN or tissue viability nurse, diabetic nurse, to psychiatrists and all those people. And once they come and see the residents, whatever they are going to advise or whatever they are going to recommend, make sure you follow that. And yeah, that's your responsibility to refer them. Another responsibility for you as a nurse in a nursing home is to do care plans and risk assessments for the residents. Now, in most of the homes, like I mentioned in my previous video, there is what they call resident of the day, where a resident is assigned a day of the month. And usually they say if this resident is in room 1, then on 1st of the month, they are the resident of that day. So everyone in the home, like all the departments, are going to come and review, and you also consult with the family in case there are any changes. Then you need to update the care plans, and you also need to update the risk assessments. So the care plans and risk assessments are things like eating and drinking, mobility, moving and handling, choking risk assessment, PEEP, which is the one for evacuation, and other things like that. So usually they review the care plans and the risk assessments every month, but if something changes, then you need to update it as soon as it happens. For example, the resident that was walking is now not able to walk without a walking aid. They've been reviewed by the physio, so you need to update that in the care plan and make sure that everyone in the home is aware of the new changes. Also update the family, okay? Yeah, so you review once a month or when required if care need changes. Another of your responsibility is documentation. Guys, or my fellow nurses, you know, if you didn't document it, then you didn't do it, okay? And in the UK, documentation is, oh my God, there's so much documentation, so many paperwork, but you get used to it in the end. All right, so the documentation that you're going to be responsible for is for you and also for your healthcare assistants. Okay, so for you, you obviously need to update what you did. If someone was seen by the doctor, the physio, the diabetes nurse, or whatever, you need to update that in the care plans. If there were changes, you need to update that in the diary. You also need to inform the family and also update that you informed the family in the notes. You know, so everything you do or everything that happens, you need to make sure sure that you update. Now, for your healthcare assistants, in a lot of homes they have paper charts. Okay, not all of them, but a lot of them have paper charts. And in the ones I've worked with, they have something they call hourly welfare checks, which basically means that the resident is checked upon every hour, and the carers have to document what they did. So for example, they went into a room, the resident was fine, maybe they needed some fluids, they gave the fluids, they need to document that. So every hour has to be filled in. Types of documentation maybe food charts, which is eating and drinking, hourly welfare charts, repositioning charts, cream charts, behavior charts. So be sure to check if they are updating, because if they are not updating, then you are also going to be the one responsible for that. If your manager comes around and sees that the healthcare assistants are not documenting, they're going to call you and they're going to ask you, why isn't this documented? Why are there gaps in this chart? And you know that there shouldn't be gaps in this chart. So motivate your team to do documentation, encourage them to ask you if they are not sure of what to document. Another of your responsibility, guys, is leadership. Okay, you're going to be in charge of the floor. In a lot of homes, you're also going to be the only nurse in the home if it's a weekend, and that means you're in charge of making decisions on things that are happening. All right, so just remember your leadership skills. Be good with your staff, just be nice to them and they'll be nice to you. Motivate them and also help them around if they need some kind of help. Okay, another of your responsibility is to help out in the home. So like I said, if you see your staff are so busy, they don't have time to do some of the things. You've done your medication, you've done your care plans, or whatever you're supposed to do, you need to also come and help them, because it's all about teamwork. And if you guys are not working together, then things are not going to run smoothly. So if you see someone needs to be assisted to the toilet, if someone needs help with personal care and you're free, help. Some of the residents need assisting with feeding, so please do that. It's also your responsibility, because we are there for those residents. It's their home and we need to help them feel as comfortable as they can. All right, so those are some of the things that I could think about at the top of my head during my break. I hope these have been helpful. Thank you for watching. I'll see you in my next video. Bye.